Senator Rand Paul is a Republican from Kentucky. He's also a medical doctor putting forward his own Obamacare replacement plan. And he was at today's hearing for Congressman Price. Nice to see you.
Thanks for having me.
Before we get to the hearing today and to your plan, I've thought President Obama at his last press conference say any thought as President Obama leaves office?
You know, I enjoyed working with him and tried to work with him on the areas that I agreed with. And I think I see some of that as we go into a new administration that's Republican. I see some on the other side aren't too happy to be working with a Republican. But I actually did try to work with him when I could on criminal justice reform. He and I agreed with, on a lot of things and tried to be supportive on that. On a lot of other things we didn't agree, but I tried to keep it on an agreeable sort of disagreement.
Well, you mentioned the new administration. You ready for a President Donald Trump?
Yeah, I think that we've gone too far. The whole pendulum on regulation has gone too far, and I really think that we're stifling our job opportunities in the United States with too many governmental federal regulations. And I think one of the things Trump's going to do is very quickly undo a lot of that regulatory overreach.
All right, doctor to doctor, to Congressman Tom Price for Secretary of HHS. Going to vote yes?
Yeah, I think he did a good job today, and he's also through the years been one of the leaders, intellectual leaders in promoting free market ideas and ways to expand insurance that would actually lower the cost and not raise the cost of insurance.
Does it help to have a doctor? And were enough doctors talked to? I never thought enough patients were spoken to when Obamacare was first proposed. But how about doctors?
Well, I think doctors do have a firsthand experience. One of the things he said in the hearing today I thought was very telling. He said as he watched his practice over the years and he saw more and more people working in the business office and less people actually taking care of the patients, that the dollars and the employee money was going towards billing and all this other compliance stuff, but there were less nurses and less assistants dealing with patients, that was a real problem for him. I also think that, I worked at one of the hospitals he worked at, Greta Hospital in Atlanta. A lot of poverty care there. It's a charity hospital. And my goodness, if you can negotiate that and take care of the horrific train wrecks and accidents and gun shootings that happen that come into the hospital, I think that's the kind of person who really has a lot together as far as trying to be a critical thinker.
I don't like the paperwork either, and I know some of it is because for a while people thought, to try to minimize fraud, make doctors fill up more papers, and I thought, just let it go. I'd rather have them doing medicine and take the risk.
Right. Well, I think a lot of people blame a lot of the cost of like Medicare and health in general on fraud, but I think I would call it perverse incentive instead of fraud. The perverse incentive is if you come in and you're a Medicare patient and you see a doctor, you're way too young, of course, but if you came in to see a doctor, they have no incentive to undercharge you because you have insurance. Same with private insurance. If you have private insurance, nobody undercharges you because you're not paying.
It's like a divorce. There's no incentive to try to make them resolve early. Let them fight because the more billable hours.
But as a patient, you don't seem to care for the price, and neither does the doctor because no one's paying.
All right. Your program, your proposal, first of all, one of the most popular things is in Obamacare. I mean, a lot of people don't like it, but a lot of people like Obamacare, is the fact that you have pre-existing conditions and you'll be covered. Does your program have that?
In the insurance market now, the people who have group insurance don't have that problem. The people who have a problem with pre-existing conditions are those in the individual market, and that's about 7% of the public. That individual market, what I want to do for that individual market is let them get together and get a group plan, and then they would be covered under the pre-existing laws that we already have. Plus, they're covered because once you have a large group plan, you have leverage to get lower prices, but you also have leverage to buy an insurance product that you want or you like. So the goal of my plan would be that nobody is left out there by themselves. So if you're a mom and pop and you own a pest control business, husband and wife, you're worried. Many middle-class people are worried. What if she gets sick? What if I get sick? And that your rates go through the roof or you get dropped. But that husband and wife who own a pest control business should be able to join with 100,000 people or 1 million people to buy their insurance. And the government laws prevent that now. We need to expand this marketplace and let anybody that wants to group together to buy insurance as a group, we need to let them. This will fix the vast majority of the problem, and for a few of the hard luck cases that it may not fix, I think Medicaid is there as a backstop for those who can't buy insurance.
Is your program, has it been scored by the CBO or your idea? So is it going to be more cost effective or less cost effective than Obamacare, or don't we know?
Ours isn't really a governmental program. Ours is a legalization program. It's a freedom program. It's giving people free choice. So some
people aren't going to take the choice. I mean, I think one one of the reasons for Obamacare was thinking that there are a lot of people out there who don't have insurance. They're not going to go get insurance, or they don't have access to insurance, and suddenly they're going to show up with a very serious problem that's very expensive.
Well, under the old system, before Obamacare, about 85 to 90% of people had insurance. It's still sort of about that. It's a little bit better now. He gave a lot of people Medicaid. So there are always going to be people who either don't save or don't have any money, and there is a government backstop. The government backstop is Medicaid. But even that, you can't have everybody on Medicaid, or how do you pay for it? And what I've said is, let's be honest. Instead of, see, under Obamacare, the president said 16 million people got insurance. Well, they got Medicaid. And he says, oh, it's free. Well, there is no money in Washington. We borrow $1 million a minute, so it was a dishonest accounting system. If you want more people to be on Medicaid, which really shouldn't be your goal, your goal should be an expanding economy and very few poor people. But if you have to have more people on Medicaid, each state should have to make a difficult decision. Are we going to tax people more to pay for it? But we shouldn't just borrow the money as a country.
So you're opposed, is it fair to say you're opposed to a single-payer system, basically government insurance?
Right. I think that as far as the distribution of goods in general, what kind of system distributes the most amount of goods at the least amount of cost? Capitalism. A single-payer system is a government-run system, or socialism, and it's not very effective at distributing goods. In fact, under socialized medicine, the only way you can distribute the goods is you have to ration them. So you have to say, well, you may have to wait a year for your hip replacement because we just don't have enough money. Under a socialized system also, you don't want more doctors, you want less, because the price doesn't go down. And this is the real problem with healthcare in general. If you doubled the amount of doctors next week, the price should be cut in half. That's the way capitalism works. In our country, it doesn't work either. If you double the amount of doctors, you'll spend twice as much money. So actually, under our current system, and particularly under socialism, if you expand the amount of doctors, expand the amount of hospitals, that goes against what they want because they'll spend more money. But if you allow prices to go up and down, when you expand the supply, the price goes down.
All right. Well, the very bottom of the income, under your program, there's still the Medicaid or even Medicaid expansions, so they're taken care of. The people in sort of the middle income group, under your program, they'll be able to join in sort of pools and keep the prices down, presumably.
Right.
The premiums be down, or the copay. And of course, the people who are in the higher income, we're not worried about them. They can pay for
right.
their insurance.
And really, a big part of what Obamacare was trying to fix was the working class, and it was not successful because what it did is it made insurance costs go up, because Obamacare said that 10 different items have to be covered by insurance
that you don't need,
even under the deductible, and it made the price too expensive for a lot of working class people.
Senator, thank you for coming back. I'm sure we'll be talking a lot about health care in the weeks and months to come. Thanks, sir.
Thank you.